1 in every 26 South African women is diagnosed with breast cancer. Breast cancer not only touches the lives of women affected, but their loved ones too. The objectives of Pink Drive is to support the women of our country who need help, support and education, because if breast cancer is detected early, the chances of it being beaten are good. Pink Drive, a cause marketing fundraisers initiative, is funding a mobile mammography and educational unit that work closely with both local and regional government to identify areas where there are no mammography facilities available. Free mammograms are offered to women without medical insurance. The Pink Drive mobile mammography units are a unique concept and a perfect way to educate and connect marginalized women to information and treatment. Both the units travel to corporate and semi-urban areas around South Africa, allowing for disadvantaged communities to have access to mammograms. Specialized educators provide information about breast health, perform physical breast examinations, and screen up to 25 women per day.
My Zulu name? I have one name. Ekabangile.
The Pink Drive Mammo truck should work in conjunction with what we are doing. We can offer no mammograms at our institution. Machine is broken, old machine is broken. New machine is still a discussion that people are seeing services where it's accessible, you can see it. And many of the patients, as they're visiting the clinic, are immediately sent to the mammo truck, to the Pink Drive Mammo truck, and the mammogram is done. It gives you a situation of hope.
Oh, it's been a magic day. The weather's been fantastic. Absolutely fantastic. The people along the road all understand the pink, and it's really been super.
So these mammograms make you to know early in time, and you have support and help is given to you. It's such a joy to go for this mammogram.
Pink Drive continues to grow from strength to strength, gaining masses of public and private support and inspiring the nation with their passion and commitment.
I would have loved if the government departments were here, if the Ministry of Health, Ministry of Education, the Department of Communication was here to witness the impact, the positive impact that Pink Drive has actually brought to the communities.
Out of the approximate 48 million people living in South Africa, only 7.8 million, 16%, have access to medical aid. The vast majority are forced to rely on increasingly overwhelmed and understaffed government hospitals, most of which have a 2 to 6 month backlog, and some of which don't even have a breast cancer service.
The strategic partnerships are very important in our government in the Western Cape, and one of the most successful ones we've had thus far is the strategic partnership with the Pink Drive. And they have made, in the short term or the short period that we've been in partnership, an enormous contribution towards mammograms and breast cancer, whether that be the screening itself, the advocacy of information and prevention and so on. It is an extremely successful partnership, and we are very, very proud of that partnership.
The information that we get from the truck is really the first type of information that we've had in South Africa. The data that we will get from this truck, even if it is just from one community, will allow us to extrapolate a completely clear view. The truck has really brought these people together. It's formed a starting point for people to rally around and start speaking about what needs to be done in this country.
Part of the mainstay of management of breast cancer is prevention. And as we know, education plays a key and important role in trying to prevent patients developing cancers, because most of the time our patients, they come at advanced stages, and we believe it is purely because of lack of education. So if we can be able to address that issue and not solely focusing on management but more of prevention, it will do us a lot of good.
Having a mammogram here will mean that we'll be able to pick the cancers at very early stages where the cure rate is higher, unlike when they come in a very late stage.
We need to teach our ladies and that to examine their bodies so that the earlier they get anything wrong with them, the earlier we can intervene and save lives.
This is like a godsend, if I can put it that way, because then, people will be able to be screened and whatever abnormality will be picked up early, the mammogram will be done, and intervention can be quite early, and a lot of people's lives and health can be improved substantially.
This is my August number 13, but my first in pink. And my daughter died 4 months ago today from breast cancer, so it's for a very good cause.
The Radiological Society is the professional association of the radiologists in South Africa, both representing private sector and state sector, public sector radiologists.
Radiation control is not an accrediting body. However, we set requirements on the licensing criteria, and we say that a mammographer has to be qualified in a postgraduate diploma in mammography to operate a mammography unit, and the Pink Drive conforms to that, and the mammographer has to be accredited with the Health Professions Council of South Africa. So Pink Drive conforms.
Pink Drive organisation campaign came to talk to Radiological Society a number of years ago, and through the process of discussion over the years, Society realised the objectives that Pink Drive wanted to achieve, which is raising the breast awareness in all communities, and understood the bona fides of the project and what the ultimate objectives were. Society took it on board and clearly wanted to endorse the project, realizing what Pink Drive was out to achieve.
Pink Drivers always have a very strong benevolent ethos. This ethos has been rooted in the goodwill of the small team that manages this very, very successful drive in South Africa. What we would like to emphasize is that we're part of the solving of an immense challenge that faces our nation, especially its women. We know that many women succumb to breast cancer in South Africa. It is ranking one of the highest, if not at least the second highest, reason why most of the mothers and sisters of our nations die today.